Nearly 6 million Americans suffer from heart failure. The condition kills about 300,000 people each year. Here, with a look at the problem and to offer tips on prevention, is cardiologist Todd Edwards of the Stern Cardiovascular Foundation. Dr. Edwards, how is heart failure defined?
Heart failure is a syndrome rather than a specific clinical diagnosis. It can be thought of as several different things, either systolic dysfunction of the heart where the pumping action of the heart is not normal, or diastolic function of the heart is not normal where the heart is stiffer than normal, or a combination of both. The symptoms that would give a patient would be shortness of breath, fatigue, swelling in your feet, increased abdominal girth, predominantly. Heart failure can be classified in terms of severity, and we still use the New York Heart Association functional class. Class 1 symptoms would be no symptoms at all. Class 2 would be symptoms with moderate exertion. Class 3 would be symptoms with just mild exertion. And Class 4 heart failure would be classified as the symptoms with at rest.
How can heart failure be prevented?
Well, heart failure can be prevented by trying to avoid the common causes. Mainly hypertension and atherosclerotic vascular disease is the major contributor. So treating hypertension would decrease the risk of heart failure. Trying to prevent a heart attack would decrease the risk of heart failure. If you have a heart attack, your risk of developing heart failure is 8 to 10 times higher than the average population. So factors such as treating obesity, diabetes, high cholesterol, sedentary lifestyles, those type of things would decrease your risk. So having 1 or 2 breakfast cereals per week, 4 vegetables per day, and have a good level of daily exercise as well as moderate alcohol consumption can help.
What is advanced heart failure and what treatments can be given to those patients?
Patients with advanced heart failure would be patients with class 3B or 4 New York Heart Association functional class symptoms has gone over before. These are patients with symptoms of rest or with very little activity. This group has a poor prognosis. In fact, the mortality over the next year for these patients are somewhere between 60 to 94% for class 4 patients. So they need another additional advanced therapies. Advanced therapies would be mainly left ventricular assist devices and heart transplantation. If you take patients that have heart failure between the ages of 35 to 74, there are approximately 374,000 of those patients in the U.S. Of those, 280,000 would have other medical conditions which would not make them suitable for these advanced therapies. So the target population for this advanced heart therapy, such as left ventricular assist devices or heart transplants, is really about 94,000. Of those, about 2,200 patients in America will get a heart transplant per year. That leaves a wide gap of over 90,000 patients that could be candidates for left ventricular assist devices that have advanced heart failure. The survival rates for transplant 1 year is 90%, in 3 years it's 85%. Survival for left ventricular assist device at 1 year is 90%, and 3 years is 85%. So with these poor prognostic patients that have advanced symptoms, these advanced therapies offer something for the future to get them back to a more normal life.
What are the complications of left ventricular assist device therapy and heart transplants for advanced heart therapy patients?
There are complications with both forms of advanced heart therapies, but again, this is in a quite sick population. The patients with the left ventricular assist device mainly have 3 problems. One is stroke and clotting of the pump. That seems more obvious since it is a pump and a mechanical device. The third risk is GI bleeding, actually, where you bleed somewhere through your GI tract. This is probably due to formation of what's called AV malformations, where the arteries and veins are hooked up right at the level of the barrier of the lining of your GI tract, and there's oozing of blood from these. This is made worse by likely shearing of what's called von Willebrand's factor from the pump. So it's the mechanics of the pump that actually cause the problem. And with our current generation of problem with our devices, we know that it is a problem in advanced devices coming down the road will hopefully solve that problem. In terms of transplantation, development of coronary artery disease, blockage problems in your heart, even if you did not have blockage problems in the first place, is the main limiting factor. Again, this is where we get to the 10-year time frame of most heart transplants, expectancy of life. Other problems, since we're suppressing the immune system on purpose, is of course malignancies and infections. Malignancies can occur, especially skin cancers. Lymphomas can occur. Interestingly, with lymphomas, actually decreasing the immunosuppression will often make the lymphomas respond to treatment better. In terms of infection, the patients are on different medications to prevent infections, but they're still at risk because the immune system is decreased by the need to prevent rejecting of the organ.
Dr. Todd Edwards, thank you very much for joining us here on Heart of the Matter.